Hi everybody, I'm Naufal. Welcome to my channel. Today we are going to discuss regarding standards of mental health nursing. The standards of mental health nursing. So this standards was established by American Nurses Association in 1973 and it was revised in 1994. The main aim of the standard of mental health nursing is to provide quality of care to the patient. The main aim of the standard is to provide quality of care to the patient. Mainly we can see two standards, that is professional practice standard and professional performance standards. We can see one by one. First one is professional practice standards. Under that, first standard, standard 1 is theory. Standard 1 is theory. So we know that the theories are formed on the basis of scientific evidence. Without the evidence of science, theories are not formed. Theories are formed on the basis of scientific evidence. Here in the mental health nursing, the mental health nurse and the psychiatric nurse will apply the theory which have the scientific base to make decisions in the nursing practice. Okay, the mental health nurse will apply the theory which have the scientific base. For example, genetic theory, developmental theory, like that biochemical theory. The nurse will apply the theory which have the scientific base. For what? To make decision. Yes, this is the condition of the patient. This care I have to give in the nursing practice. That is the first standard. So in the first standard you have to keep it in mind, that is theory. Theories are formed on the basis of scientific evidence. Here the mental health nurse will apply the theory which have the scientific evidence to make decisions in the nursing practice. The nurse will take decision with the help of the theory in the nursing practice. So always keep it in mind, for theory there will be having scientific evidence. That is the first standard. Next one is standard 2, that is data collection. Standard 2 is data collection. The nurse continuously collect the data, that is the information regarding the patient. That is systematic, accurate and comprehensive. The nurse collect the data, that is systematically, step by step, and accurate, that is perfect, as well as comprehensive. The total or the whole data will be collected. Mainly the methods used to collect the data is interview, behavior observation, physical examination, as well as mental status examination. All these methods will help the nurse to make a conclusion. Okay, to make a conclusion, the data will help the nurse. Yes, this is the condition of the patient. These are the things I have to do. So all these collected data with the help of different method help the nurse to make conclusion, and which will help to plan for intervention. That is the plan of action, which will help the nurse to make some plan of action. Okay, that is data collection. Standard 3 is diagnosis. Here the mental health nurse, in diagnosis, the mental health nurse utilize the standard classification of mental disorders. We know the classification of the WHO ICD-10 classification. The mental health nurse will utilize the classification of the mental disorders to make conclusion. This is the condition of the patient. With the help of the collected data, the nurse will formulate the nursing diagnosis. Here in the standard 3, the nurse utilizes the standard classification of the mental disorders to make the conclusion, and with the help of the collected data, the nurse will formulate the nursing diagnosis. Here the nurse will identify the actual problem as well as the potential health problem of the patient. Actual health problem of the patient as well as the potential health problem of the patient. That is, actual means the real or the present problem, as well as the potential means the risk or the future problem, the risk factor for that patient. All these things will help the nurse to plan for the intervention, that is for the plan of action. All these things will help the nurse to plan for plan of action. Okay, that is standard 3. Standard 4 is planning. Standard 4 is planning. So in planning, the mental health nurse will use a problem solving approach. A problem solving approach, how to solve the problem. Like that approach is used by the mental health nurse while preparing a plan of care. The mental health nurse will use a problem solving approach for what? To prepare the plan of care, that is the care plan. While preparing the care plan, a problem solving approach is used. So here the mental health nurse will use the plan of care or the care plan. The nurse will form a care plan which include the nursing intervention, that is the plan of action which prescribe or which have some expected outcome. Okay, in this care plan there will be intervention or plan of action which have some expected outcome. For example, the intervention or the plan of action is provide behavioral therapy to the patient. So the expected outcome is changes in the behavior of the patient. Okay, that is regarding standard for planning. A problem solving approach is used, as well as here the nurse will formulate a care plan. In that care plan, intervention will be there. For that intervention, a expected outcome will be there. That is regarding the standard 4. Next one, standard 5, that is intervention. So in the standard 5 regarding the intervention, the nurse will implement the intervention. Okay, the mental health nurse will implement the intervention that is there in the care plan. What are the intervention there in the care plan? The nurse will implement. That means the nurse will apply all that intervention or plan of action that is written in the care plan. Here the mental health nurse will use different types of intervention. For example, psychotherapeutic intervention, psychotherapy, health teaching. Like that intervention the mental health nurse will implement in the standard 5. What are the intervention? It is there in the care plan. Here the mental health nurse will implement or apply that intervention. Okay. Next standard, the standard 6 is evaluation. So here the mental health nurse will continuously assess the effectiveness of the care given by the nurse. Continuously evaluate the effectiveness of care given by the mental health nurse, whether the goal has achieved. Okay, here the mental health nurse will evaluate the progress of the care given by checking the changes or the progress in the patient, whether we have achieved the expected outcome. Here we collected the data, diagnosis we made, plan of action we made, and intervention also we made. Here we are evaluating whether we have achieved the goals. If the mental health nurse is feeling we have not achieved the goal, again more data has to be collected. We have to collect the data. Any changes in the diagnosis we have to make, we have to change the diagnosis. Further planning is required. We have to make more planning in the evaluation. So evaluation is a continuous process. Okay, it is a continuous process. That is regarding the professional practice standard. Next one is professional performance standards. Professional performance standard. Here the standard 7, it's a continuation only. Standard 7, that is peer review. Peer review. That means the review of the colleagues or the co-workers. That means other nurses who is working with the mental health nurse. The other nurses who is working with the mental health nurse, that is the co-workers or the colleagues. They will evaluate you. They will evaluate the mental health nurse regarding the care given, regarding the documentation, everything. So in this they are evaluating, other nurses are evaluating you. Other nurses are evaluating the mental health nurse, and you are evaluating other nurses regarding the strength, regarding the weakness, regarding the quality of care given. The main aim of the peer review is to improve the quality of care. So other nurses will evaluate and they will identify the strength and the weakness. What are the changes we have to do? The main aim is to improve the quality of care. Okay. Next one is standard 8, that is continuing education. Continuing education. Here the mental health nurse will contribute to the profession, as well as the mental health nurse will update their professional knowledge by participating in continuing education as well as in service education. The mental health nurse is contributing to the profession as well as updating their professional knowledge. How? By participating in the continuing education as well as in the in-service education. So what is continuing education? For example, a diploma holder, that is a GNM nurse, is updating or upgrading their knowledge or their degree into post-basic degree. They are making their diploma to degree. They are continuing their education. And in-service education means within the service only. They are working along with the service. They are getting some kind of training. For example, how to use the ventilator or regarding the use of the infusion pump. Within the service only they are getting some kind of courses. That is in-service education. So for the professional growth as well as for the personal knowledge, to improve or to update the personal knowledge, the nurse will participate in the continuing education as well as in the in-service education. Not only participating, the mental health nurse will organize also. Sometimes the mental health nurse will organize the continuing and in-service education. Next standard is standard 9, that is interdisciplinary collaboration. In the standard 9 interdisciplinary collaboration, the mental health nurse will collaborate. That means the interdisciplinary collaboration means the mental health nurse will cooperate with other health team members, like with the psychiatrist or with the psychologist or with the occupational therapist. They will collaborate or cooperate with the other health team members in assessing, planning, implementing and evaluating the mental health services or in the mental health care. Okay, they will collaborate, the mental health nurse will collaborate with other health team members regarding assessing, planning, implementing and evaluating the mental health care. Okay, next one is utilization of community health system. The standard number 10 is utilization of community health systems. So here the community health nurse will participate with the community members. Community health nurse will participate with the community members, like the religious leaders of the community or the political leaders of the community or the local leaders of the community. The nurse will participate along with them in assessing, planning, implementing and evaluating the mental health services and the community health systems. Sometimes the community will be following other type of treatments. Not only the allopathy, sometimes they will be following Ayurveda or naturopathy or homeopathy or Siddha, whatever it may be. Sometimes their traditional treatment also will be there. So the nurse is participating with the community members, the leaders of the community members, and the nurse is utilizing that community health system. So the mental health nurses including their participation and in the assessing, planning, implementing and evaluating the mental health service also. The nurse is participating along with them. Okay, that is utilization of the community health system. Last standard number 11 is research. Research. We know research means we are finding solution to a problem or we are finding answer to a question. Here the nurse, the mental health nurse will participate in research. Through research, the nurse will identify new theory. She will make innovations in the theory. Sometimes she will find some mistakes in the theory. So she will purify that theory or filter that theory and she will make innovations in the theory, and by this participating in the research, she is contributing to the profession. So participation of the mental health nurse in research will help in the innovation of the theory. It will help for the personal growth as well as for the professional growth of the mental health nurse. These are the standards of the mental health nursing. It is mainly, we can see that professional practice standard and professional performance standards. That's all regarding the standards of mental health nursing. We will meet soon with another video. Till that time, thank you and goodbye.